we've got Dr. Kevin Kavanagh. He's a retired physician and also founder of Health Watch USA, a national organization. And good morning to you, Dr. K.
Oh, good morning, Jack.
We gave you 2 days off, so now we're going to work you to death. How's that sound?
Yeah, well, that's okay. I'm ready to go.
You were off for a couple of, nothing serious, but a couple of medical checkup kind of things. And one of those things, there's a reason behind my asking this, I assume, and maybe both of them were down in Somerset, where you're from, right?
No, they were up in Lexington.
Okay, yeah. Well, the reason I ask about Somerset is I've got a text just to start the hour off, and I know that you are going to have something to say about it, from Dave, that says, first of all, 99% of people are wearing a mask and distancing. He goes on, let me read it all. 1% of non-compliance will not produce the increasing numbers daily. People and businesses that are doing the right thing are being punished by more restrictions. The irresponsible response to this virus will cause damage, more damage than the virus itself. Now, you are from Somerset. You spent a lot of time here, I know, but you're from Somerset, and you say the percentage of people wearing masks there is what would you get?
Oh, I would say if you're out in the community, about 50%. Now, if you go into a retail store, there may be higher compliance, but you still see people saying, oh, I've got a medical condition, I won't wear a mask. Personally, I've worn a mask, stepped away from people who weren't wearing a mask, and they actually verbally would accost me saying, why are you backing up? Like I was some sort of a crazy person. So, no, I think that Dave needs to realize that not everybody is doing that. Certainly nationally, people aren't doing that. No one has a 99% compliance. That, again, is misinformation. It needs to be much higher, and it needs to be consistent. And I can tell you, I think that even our healthcare facilities need to increase their compliance and vigilance. For example, when I went for my procedure, I saw one person who had their mask below their nose, and this was a staff member, and I corrected them. Believe me, speak out if you see that. One person who had a valve on their mask, and as we have talked about, those are not acceptable in a pandemic. The CDC suggests as a stopgap measure till you get a better mask, put a sticker over that valve. Drives me crazy that the 6 feet that they space out chairs don't take into consideration traffic flow. So for example, they'll have a chair right next to the door. That doesn't work. You should be 6 feet away from people, period. And Jack, I've reviewed grants where the whole grant is looking at traffic flow within facilities and to avoid person-to-person contact and to avoid the least amount of trips so you could prevent spread of virus. And this is within healthcare facilities. And so you don't want to have people out there mingling in halls and just doing chit chat and walking down to just talk to someone about, well, what are you going to do tomorrow for lunch, etc. That all needs to be minimized within a facility because we are getting into a very dangerous time with this virus. And all of that I feel needs to be done, and also needs to be done in retail facilities. Now, the other thing that this caller needs to realize is that masks are not, wear a mask, you're safe, don't wear a mask, you're in peril. A mask is a coating on your armor. It's kind of like a bulletproof vest. Yeah, it's going to help, but you're probably not going to jump out of a foxhole with just a bulletproof vest on because you're going to get shot. It will help, but you need to wear other things. And one of those other things, and we've talked about this before, is goggles. Consumer Union came out with saying wear goggles. Dr. Fauci's now saying it. We've talked about this for weeks. If you have to go within a retail store to pick up something, please wear a mask, but wear goggles. Stay 6 feet apart. Go in there for the least amount of time possible. You should be doing ordering online and pickup. Very important. And Jack, at the risk of getting the heat of 1,000 suns, don't have a family gathering for Thanksgiving this year. You want to make sure that all of your family will be present once we get the vaccine during your Thanksgiving next year. That's very important. So what are we doing for Thanksgiving? We've got 3 family bubbles in Lexington. We're going to each cook part of the Thanksgiving dinner, kind of do pickup where we put, our portion out in the garage. Other people can pick it up. They can nuke it in a microwave to make sure it's sterile. We're going to play an online game like Clue where everybody can log on and play, have FaceTime or Zoom or whatever teleconferencing you're using at home, and try to have a family gathering that way. So we're going to do Thanksgiving differently. We just have to do it because this virus is surging.
Let's go to the phones. Jim, good morning.
Mr. Kavanagh, if they've got the vaccines kind of lined up or whatever, I mean, I don't know. You're a doctor. You know more about it. Why does it take so long to distribute it? And I'll hang up and listen to the people. Thanks.
Yeah, we've got 2 promising vaccines now that have 92, 95% efficacy. What's the next step to get those out and start getting people vaccinated up?
Well, they're going to have to get approved by the FDA. That's number 1. Number 2 is one of the vaccines requires being stored at minus 100 degrees Fahrenheit. That's problematic. That's dry ice. And so you need to get ultra cold refrigeration in. The other vaccine, Moderna's, much better. It's can be minus 4 degrees Fahrenheit, which would be, for example, what a deep freeze can reach. And so that's a little bit better. And once that vaccine's cracked open, it can be in a refrigerator for up to 30 days. So its distribution is going to be better. But they do need to get the things packaged. They got to get them into trucks. Trucks need to get distributed. They need to train people on how to take care of the vaccine, how to give it to patients. So there's a lot of things that have to happen. And you need to realize they don't have enough doses for everybody. I'm talking about even the healthcare workers. So it's not going to be available for you and me and probably sometime in the spring, maybe not to the general public if you're a young, healthy person till late spring, because the doses just aren't there at this point.
Let me read another text to you, because this is the reasoning that people have here. This is from Mike. It says, I, for one, am tired of Andy up there shaking his finger at us. I traveled the state day after day after day, and I see all people wearing masks. When does this become less our fault and more on the state's fault for not preparing for the second wave, which they have been talking about since April or May? Don't bury me for your inadequacies. We're doing our part. Step up and do your part, Andy. How do you respond to that?
All right. Number 1 is people are not doing their part, okay? They're not social distancing enough. I've just gone through my experiences on what's happening. They're not wearing masks enough. They're not staying 6 feet apart. And that's a minimum of 6 feet because, as you know, under certain circumstances, the virus can aerosolize. And this means doing it consistently. You only have to not do it one time and the virus will spread. And of course, people are doing family gatherings all the time. I just walk around my subdivision and I see people doing gatherings from one neighbor to another neighbor. All of that will spread virus. Number 2 is you have to realize that Governor Beshear is a state level person. The N95 masks just are not available for all frontline workers. And I mean grocery workers, postal workers, everybody needs to have those. They're just not there. And believe me, they should be. And that is a shortcoming, but that can't be corrected on the state level. They have to be mass manufactured. They're somewhat difficult to manufacture, and you're going to have to evoke the Defense Production Act to do that. And that's one of our big shortcomings. We have not had that done, and we did not stock up nationally to rev up our production. It's not as simple as sewing together a cloth mask. You need to have a Defense Production Act to make these very technically constructed N95s. And I should add that when I say wear a mask, this needs to be a well-fitted mask without holes on the side, multiple layers. Get rid of these neck gaiters. Let's start taking this virus seriously.
One more question before we go to break. Can my eyeglasses I wear help provide any protection short of goggles? Will they do instead of goggles, glasses?
They do help minimally. Goggles will give you maybe a 3-fold increase in protection over just wearing a mask. So mask is a 6-fold protection. Goggles add another 3-fold. Glasses, a little bit, but don't count on it.
Says I can tell you going into 25 small, medium businesses each day, every day for my job, not on Main Street or big box stores, you would think there was no COVID-19. 90% of those businesses, about 5% of the customers are wearing masks. So this supports exactly what you said earlier in the show, Dr. Kavanagh. Now, let's take a call from Mary. Hey, Mary, good morning.
Good morning. Question. I've been in a couple businesses recently that people weren't wearing masks. Everybody wasn't. And I made a comment about it, and they said, oh, we can't legally make people wear masks, even though we advise that. Is that true, or can they?
Absolutely not. If it's your private business, you can require people to wear masks. And I think, Jack, you were probably, when you're saying that 95% of the people in stores weren't wearing masks, this is kind of what I'm seeing. That is not good. And the people that are calling up saying 99% are, those, in my opinion, are just trolls. I mean, they're not telling the truth. If you were out in anywhere in rural Kentucky, you would know that's not correct. And there's a lot of misinformation. It tends to be organized. And we really do need to push back on this because this pandemic can get a lot worse. Our rates, if we're equal to South Dakota, would be 3 times higher than that. Means our hospital beds 3 times as full, and they would be still filling. So it can get much worse than what we have right now.
All right, thank you, Mary. Mark says the science has proven that neck gaiters work as well as cloth masks. That's one of those areas where they came out and said they didn't, and they came out and said that it did, and that's why I think a lot of people are confused. So what is the latest on that?
Well, it's going to depend upon how they're constructed. And it's not going to work as well as masks if they're not constructed of a dense fabric of multiple layers. And the thing I don't like about neck gaiters is that you keep pulling them up and down. And every time you do that, you can potentially contaminate your hands. Remember, I've said have some hand sanitizer in your pocket to wash your hands if you touch your mask. So I don't think they're as good as a mask. You want a well-fitted mask. Well-fitted means air's not going out the back. If you have to adjust it, that means it's slipped. It's not well-fitted. Masks need to be an appropriate mask. And if you can get an N95, that's even better. Remember, they're not totally protective. Goggles, gowns, etc. You would need to have that. And certainly we can get goggles at this point.
Some restrictions that have happened now in the last few days. Michigan has shut down indoor dining in restaurants, ordered high schools and colleges to halt in-person classes. Washington's going to enforce stricter limitations on public gatherings, including funerals, which will be limited to 30 people. Oregon's going to limit indoor gatherings greater than 6 people to just 2 households, including Thanksgiving. Even North Dakota, which has avoided many restrictions, enforcing statewide mask mandate. The word has it that if we don't do better in the next day or two, the governor in Kentucky, Governor Beshear, is going to issue some more restrictions. If you had your way in the minute and a half we have left, what restrictions would you have in Kentucky?
Well, I would restrict indoor dining and bars. That's number one. And also, you need to get people wearing masks. And that means you may need to enforce our mask mandate. 33 states now have a mask mandate, and that includes many Republican states of North Dakota, Texas, Virginia, Massachusetts, Ohio, Indiana, Alabama. They have all gone that way. Masks help. They're not going to solve the problem. They help. You're going to have to wear a mask if you have to go out and have contact because this virus is still surging. It's going to get worse than what we're seeing now. And remember, when it peaks, you still have weeks to go before you see deaths and hospitalizations peak.
All right. Thank you, Dr. Kevin Kavanagh. Thanks for being with us.